My dad had stroke 16 years ago. We've been managing him, had a swollen heart. We had a very nasty experience during this coronavirus outbreak.
So we took baby to the hospital, and the baby was so sick. He had, serious jaundice and some infections because he had been exposed to rain and harsh weather. Hospitals had rejected, admitting the baby because of the COVID-19 pandemic.
We, after I had gone through the treatment, I'm okay and everything, now sent me a text.
3 Nigerians share their story on fighting for their lives and those of their loved ones during the lockdown and at the prime of COVID-19 wave in Nigeria. This documentary covers the outstanding events and commentary on COVID-19 effect in Nigeria. It focuses on how COVID-19 pandemic had been localized, an epidemic in the territory, and an outbreak shared among loved ones, an experience of rejected emergencies. Operations of hospitals during COVID-19 has been difficult. Any emergency case could be the spread of an epidemic. Anyone walking through the doors could have been infected or can get infected. COVID-19 disease has come to test the public health systems of many countries, including Nigeria. The public health system in Nigeria has been underfunded for years. According to Nigerian President Muhammadu Buhari, we now face the biggest challenge of our generation.
We have introduced healthcare measures, border security, fiscal and monetary policies in our response. We shall continue to do so as the situation unfolds. Some of these measures will surely cause major inconveniences to many citizens, but these are sacrifices we should all be willing and ready to make for the greater good of our country.
Over 1,000 lives have been lost to the pandemic, but many more have lost loved ones because COVID-19 disrupted other medical services.
Daddy was 70. My dad had stroke 16 years ago, and we've been managing him since then until he passed away. He had a Federal Medical Center, Jabi. Once you've had stroke, your life becomes about it. Comes down to management, and I think because of the prolonged use of drugs, he had a swollen heart. And when this last time it happened, we had a very nasty experience during this coronavirus outbreak. There are some seasons, yes, he'll be down, he'll be under the weather, we'll go to the hospital, he'll be admitted, conducted a series of tests. But when this last one that came, we couldn't access medical aid or adequate medical attention because of the outbreak of the coronavirus. We went to Lokoja first because he's in Kogi State. We went to Lokoja first. He was in Kogi State. When we got to Lokoja, they checked him, did some series of scans. They said his heart was bloated, and we should discontinue the use of some drugs. And I think they prescribed some drugs that it will help him return to normal. And when he wasn't getting okay, we now brought him to Abuja. And that was where the real challenge started from. We went to Wawalada Specialist Hospital. They rejected him, that they were not taking inpatient because of the coronavirus, even with the condition. We now went to Gariki Hospital. We went to National Hospital. From National Hospital to Gariki Hospital, it was the same story. They were rejecting him until we got to Jabi Hospital, where he was admitted because we have an uncle that called and was like, "Oh, you should take care of him. You will even have a holding facility in case it's coronavirus, where you can keep people and examine them for sometimes." And when they gave him some drugs, they admitted him. After enough back and forth, they admitted him. They administered some antibiotics and some other things. He started recovering. Then later on, he passed on. And yes, it's kind of very terrible for us. It's painful, where your person could have lived if he had gotten adequate medical attention early. But because of the fear of the pandemic and the doctors were running, nobody wanted to even, in fact, it's not the best time to fall sick. It's not the best time to fall sick. It's just now a lot of people are self-medicating because if you go to the hospital, even the fear from the doctor, the nurses and everybody, it's just better you stay at home and take care of yourself. That's what every man to his tent.
The Minister of Health stated that rejecting emergencies was unethical.
It is unethical to reject patients who come to the hospital for treatment. I have said here repeatedly that every person who comes to the hospital must be seen and attended to, and at the least given advice. You give him advice on what to do. If you can't handle it, advise them where to go or call transport for them. But to just say, go, we don't handle that is unethical, is not acceptable.
The state governor of Kogi, Yahaya Bello, argues on the public health stance of the society due to COVID-19.
People can no longer go to even hospital because doctors are being reported to be dying. Health workers are becoming scared. Any small illness ordinarily that you should go to the hospital for treatment. Nobody is even willing to go. If you even go, nobody to attend to you. You will die. Not as a result of COVID-19, but the fear. People are developing high BP daily. If I was asked question, how many have we lost? Unfortunately to COVID reported. How many deaths have we recorded since the advent of this COVID owing to other ailments? We're not giving account of all of that. I want to believe it is in the neighborhood of hundreds per day. Hunger, malaria, heart attack, childbirth, Lassa fever of recent and rest. Yes, we are blinded to all of these. Our attention is geared towards COVID-19.
The procedure for health testing also suffered a huge blow. A COVID-19 survivor narrates that he got infected and was discharged from the hospital before he was confirmed positive.
Well, it's good to talk to you. It's also good to know that you're one of the survivors of COVID-19. Let's start with your experience. What was it like from the point of contracting the virus and then trying to find some level of healing down the road?
Actually, I started feeling sick, I think sometime in late May, early June. I actually went to one of the labs to get a test. Initially, I thought it was malaria, but I eventually found out that it wasn't malaria, that there is no malaria product, but I knew I wasn't really feeling well. So a friend of mine actually asked me to go and take the COVID test. I went to the International Conference Center, which was like where the hub for the testing is in Abuja, and it was, the first day I went, they asked me to go back and text that I should call the NCDC line. I said, I'm here already, I'm not feeling fine. So I just take the test. They said, no, I have to go back. So I went back home, tried calling, eventually I got through and scheduled the test. So I went to do the test. In between the test and the result, I was really, really feeling bad. So I took myself I was driven down to National Hospital, Abuja, and there too they said they needed to get the confirmation of the result, if it was positive or negative. I was now asked to go to Asokoro General Hospital, which was like a holding hospital. I got there, they didn't even open their gate. It was like, no, we are not taking anybody here, just go bring the ambulance. I said, guys, I'm dying here. Can't people just, admit me and let's, proceed from there. So that day, I had to go back home. Later that night, it I really started feeling terrible because I couldn't breathe properly. My temperature was about 40 something. And so I called a friend who came to pick me and drove me down to the National Hospital again. So at that point, when they saw my condition, that they now had to admit me and give me a bed. That was a journey. But it was really funny because, God forbid, if in between going back and forth, someone could have lost his life and all that, but I was able to get a bed at my third accident at the National Hospital, and from there, treatment started. That's my test that they took my sample. The results came out when I had been discharged from National. Officially, I had to use a back channel to get the results. Then, because the National Hospital said without NCDC confirming that I was positive, they wouldn't admit me. So I used my cousin there to get the result. But the official result came out way after I'd gone through the treatment. I'm okay and everything. They now sent me a text that my sample that they took came out positive.
He survived because he knew people in the health sector. The historic effect of COVID-19 will always be with us, despite its novel nature. In an interview with Professor Titus Ibikwe, a virologist, he explains the etiology of the virus.
We say that COVID-19 is a disease of nature and nurture, because one active disease, as it were, is just like an epidemic, because it can affect society and spread like wildfire. So the effort should be treating this like the white polio to ensure that it's completely eradicated within our country before we can beat our chest. That's why some of the figures we're seeing now, it is something to cheer about that it appears to be on the decline. But again, it could be deceptive if we over-relax our guards. At least in Nigeria, about 60% are below 60 years. And we know that this set of people are those who have some good measure of immunity that are able to fight back when they get exposed to this illness.
The pressure on the health workers to provide adequate service also comes with the risk of its kind.
If I'm putting a patient in a ventilator and I'm supposed to dialyze this patient, how many hospitals in Nigeria have dialysis machines in their intensive care units? The working conditions itself are so small and poor that we do not have that technical know-how to, even when we do have the technical know-how, we can't even have these machines to even work.
Another experience of the disruption of COVID-19 is shared in the next story.
Okay, so the baby's mother was the victim of trafficking. Like she had the baby. Sorry. She had the baby. She had the baby, and she is a drug addict, a drug user. So she was using the baby to beg for alms so she could use the money for drugs. And then she was arrested by NAPTIP with the baby. And so Dorothy Foundation offered to help. They said they could give they could support the suspect with rehabilitation, and then they reached out to me for childcare support if I could do that. So actually we rushed the baby to the hospital. They reached out to me for medical assistance, really. So we took the baby to the hospital, and the baby was so sick. He had, serious jaundice and some infections because he had been exposed to rain and harsh weather, and he was not well fed as well, and he was preterm. He was underweight. So it was quite a very challenging moment, I knew that before Dorothy reached out to me, hospitals had rejected, admitting the baby because of the COVID-19 pandemic. There was this fear, oh, could he be a COVID patient, So I haven't worked with several children in the past and currently. I have links with hospitals and doctors that I work with. So I reached out to one of my doctor friends at Federal Staff Hospital, Gwarimpa, and I told him we have a baby who is so sick, and we needed to give care to that child. So that he should please help me reach out to his colleagues, because we wouldn't want to get to the hospital and then they will still reject us like other hospitals did reject us. Okay, the reason they didn't want to attend to the baby firstly was because every patient was a suspect of COVID-19. And then another strong point they said was his preterm. So they didn't have facilities to give care to a preterm baby. So he was very tiny. He was less than 2 kg, at that time. So they were scared that they couldn't manage him and he may not be able to make it. But I just had faith that, with proper care, he will make it. So those are the experiences. Like he was preterm. So he needed to be in an incubator, and all of that. And with and he needed to be cared for by a pediatrician. The pandemic, I didn't care if I was going to contract, the virus, because I also knew that even if I contracted it, somehow I will recover. And even if I didn't recover from it, at that point I wasn't thinking of my life, because when I saw the baby, all I felt for him was, compassion. I felt so much pity for him, and I just knew that I was ready to take a risk to save his life. So going to the hospital, I knew I had to use my face mask, but I also still knew that using the face mask might not still save my life. I just said my short prayer and I said, Lord, just protect me. I'm going to take care of this baby and I'm going to get there and see what's going on with him, follow up, whatever it was he needed. I will give my support as I could, trusting God to, be with me. And that was it.
So just to ask you now, how is the baby? How is his state of health compared to when it was given to your custody?
The baby is doing so well. When I met him, he weighed about 1.8 kg. But today, he weighs almost 10 kg.
Wow.
And he's going to be 6 months in 2 weeks. And, he's fine. He's never been sick. He has never slept in the hospital since he's been in my care. We've never treated malaria in 6 months, so it's a testimony. He is so healthy. And when I take him to the hospital, for his usual vaccines, it looks like he's the baby. Mothers are curious. They're asking me, baby friendly, are you a baby friendly baby? Is it exclusive breastfeeding I did for him? But he has never, been breastfed, but, God has kept him, and he also gave us strength to give care to him. And that was it. That's it. He's doing great. He's so healthy. I think he's even healthier than my biological son right now.
Other stories emerge.
My name is Bashir Labaran. Yes, actually we took my father to Aminu Kano Teaching Hospital then, and we spent the whole day without any doctor attending to us. When we realized that they might not treat him, we took him back home. And after a day or so, he was really struggling to breathe. And after that, we took him back to a private hospital where he spent a day before he finally gave up. My father died. As at the time we took him to the hospital, he was finding it really difficult to breathe. And we informed the doctors, but they didn't do anything. They said we should wait by the side. We waited and waited without anybody attending to us. This happened at the peak of the coronavirus outbreak in Kano. I believe the doctor's failure to attend to us was the main reason why he died, because he wasn't even able to breathe and nobody treated him. The emergency unit was overwhelmed when we went to the hospital. There are a lot of patients, some were on the ground and some could not even have a bed space. They suspected it was coronavirus, probably that was why they did not treat them.
As a response, a number of Nigerians started self-diagnosis and treatment of new emergencies with other alternative perceived solutions. The new emergency now was dealing with the perceived rumors of cure in herbs.
Were you also of the opinion that what's called herbal concoction works for the treatment of COVID-19?
Yes, it works, depending on how you use it, the usage. For example, now let me use myself as a sample. During this COVID, I felt sick. Before I went to hospital, I took some concussion, stimming, all that. So I was okay, but I just left all those concussion. After like 2 weeks, I fell sick back to the extent that I could not have any stamina. I have to go to hospital. After all those medication in hospital, a little bit okay, I still use concussion. Most of them is very good to boost your immune system, so that even if you go around, if anybody touch you, all those COVID-19 ideas, so you'll be okay. Many people have the COVID, but they don't even know because they use some medication, the herbal concussion that boosts their immune system. Okay, I took ginger with one leaf, they call it ewe tea leaf. So we we burn it together. Is it burning? You know when they said this chloroquine leaf, we can come goji, so that is used to make chloroquine. So I use that one with ewe mango, epo mango.
You combine them
all together with lime, amakote. You cut it into two. You use many. Then alligator pepper, atari. Yes, so that all those things, it will definitely disappear. Once you steam, even if you have anything, it will just disappear.
Well, the answer is yes and a no. A yes, because the hospitals were, the epicenters of the disease. We cannot be sure that if you are coming to the hospital because you have headache, we cannot be sure that it is not COVID-19. So you remember that hospitals were shut down during that time. So hospitals were just being careful. They didn't want to, just allow anybody to come into their premises and then that person will now be spreading the virus all around. So they were so cautious. So that's the yes side of it. It was okay that they were turning people back, but I think that what they should have done was to subject people to COVID-19 tests in the first instance. On the flip side of it, I understand that even COVID-19 test was and is still expensive. So you understand that they couldn't just ask anybody to just go for test, just like, particularly if they were not sure. It's just about not being sure that you are a risk to all the other patients in the hospital. On the other hand, I think that it was wrong for hospitals to really turn people back. When people come to hospitals, it simply means they have some ailments, and the hospitals are the places that people should get healing for whatever ailments they have.
There are gaps in how health workers in Nigeria are trained to handle outbreaks.
So generally, when such situation arises, one, you want to seek for more knowledge, and more researches are done, and then you also want to do observation of patients who have had the disease. For example, then what is the likely prognosis of that particular disease? So that has gone a long way because health workers have enlightened themselves. More researches were done, more publications were done than in any other disease pandemic that has ever happened. So more knowledge to the health workers on the coronavirus disease, done, and then with that, the more knowledgeable you are, the more confident you will be, and the more you know how to handle or how to protect yourself from the disease. Before, it is not even known what are the different modalities of transmission. But it was later found out that it's usually from aerosols, from the air we breathe, and so on. It's not transmitted via blood and other means.
As the infection curve of COVID-19 among Nigerians dwindles, mistrust for health services in Nigeria remains despite pledges to fund the health sector. For some individuals in Nigeria, it is wise to limit interfacing with the health sector during an emergency than to plead not to be rejected. This documentary is produced by Femi D Amele as part of the Prevent Epidemics Nigeria Journalism Fellowship with support from Nigeria Info FM and Nigeria Health Watch.